This is Anu and you are watching Anu for Nurses. Today we shall continue reviewing the conditions of ear. And two conditions we'll be discussing today. The first important one is Meniere's disease. Whenever you think about Meniere's disease, the first point usually comes to our mind is vertigo. So, this is a disease of the inner ear that's mainly affecting the endolymphatic system, and there will be collection of more endolymphatic fluid due to some unknown reason. Sometimes it can be some environmental reason or the stress factor, lifestyle, familial history, or some food allergy can be the reason. What is more important about this is the triad of features, that is vertigo, tinnitus, and hearing loss. There are two progressive hearing loss. It's very, very important. And how do you manage this? Since it's like a more fluid collection, diuretic, but not the strong ones, the weaker ones, you can say the thiazide group of diuretics. And another important point to remember is fluid and salt restriction. That's very important. And many times questions have come from this area. Sometimes some patients will also have nausea and vomiting too. And for this vertigo and this nausea vomiting can be treated with some vestibular sedatives kind of drugs. For example, Stemetil, Tugeron and all you must have seen in the clinical side. And antihistamines also helps to an extent. It improves the blood supply to inner ear and helps in the better absorption of this endolymphatic fluid. Now the confirmatory test is electrocochleography. And what is the nurse's responsibility here? Since the patient has vertigo, there is chance for falling. So what's the safety is the first and foremost priority of nursing care here, and maintain the fluid balance since they are on diuretics, and see the dietary management. You need to control salt in the diet and also fluid restriction plus caffeine, alcohol, tobacco, stress. These things can trigger Meniere's disease, so say a big no to these. This is very important in Meniere's disease. So remember, I repeat the most important points in this to remember. One thing is the problem is with inner ear endolymphatic fluid, and then the triad of symptoms. It's a vertigo, tinnitus and hearing loss. Also remember about the use of diuretics plus salt and fluid restriction. And remember, the priority in nursing care is always safety. And what all things to be avoided? That's caffeine, alcohol, tobacco and stress. That's all about the Meniere's disease. So simple to remember. Now I'll give you one scenario. A 4-year-old boy was irritable and was touching the side of his head frequently, pulling ear and developed fever after 2 days with ear discharges. What can be the probable diagnosis? Yes, otitis media. That's a middle ear infection. Otitis media can be caused by mainly tubal block, we must say, eustachian tubal block. And there will be always a pre-separation period. You know that the separation period is something related to the pus formation or infection. So the microorganism starts working here. Then it leads to that separation period, and mentioned before, in chronic separative otitis media and all, there will be membrane bulge. That's very important typical feature. There will be a membrane bulge, and then it enters to the stage of resolution. Here there can be rupture. Rupture of the tympanic membrane will be causing discharge. But it's not necessary. Resolution without rupture also can occur. That means without complication. That's much better if you are identifying it at the early stage. Finally, it might lead to complications. It can cause rupture, hearing loss, or even it can spread to the brain like meningitis or infections. So that's the stages of otitis media. Not very important, but it's good if you know this. Then what's more important in this is the chronic separative otitis media. If there is a perforated membrane in this with discharges for more than 12 weeks, that's a criteria considering to be the diagnosis of chronic separative otitis media. Two types are there mainly, tubotympanic and aticoantral. Tubotympanic means there will be usually this tubotympanic, you can say it's a complication of acute otitis media, and there will be the perforation usually will be the central, and it's not very risky with low risk for the other complications like hearing loss, all those. And etichoandral is considering to be more dangerous, and it's usually associated with the condition cholesteatoma, and the perforation will be usually marginal. And this is the two types, tubotympanic and etichoandral. This main point you need to remember is about the criteria for CSOM, that's more than 12 weeks of perforated membrane with discharge is the criteria. And what's the reason for this? We know usually it's more commonly seen among children, that to infants and toddlers, that with frequent respiratory infections, or those of infants with cleft palate, there won't be closure of the palate, so there is easy chance for the feed to enter into the ear and can lead to ear infection. That's one of the complication of cleft palate and all. And some seasonal like winter and all, children will be getting frequent cold, that can be another reason. And again, another interesting thing, bottle feed in supine position or use of pacifiers can lead to this. So breastfed babies are at low risk, and the bottle fed pacify using babies are at more risk. Another thing is passive tobacco smoke. At home, if somebody is smoking and the child is getting exposed to this frequently, this is another risk for developing otitis media. Family history also can cause. That's very important. Now, another important tip for your exam, the organism frequently causing this otitis media. That's the Streptococcus pneumoniae and H. influenza, Haemophilus influenza. Remember, these two villains have got significance in many other areas like your meningitis, pneumonia, otitis media. These three infections, when you take the first organism, the most common organism causing this are Streptococcus pneumonia or H. influenza. After that only any other organisms comes. Very important to remember, guys. Now the features. Of course, it's an infection, so fever will be there with pain, discharge, and the babies mostly first thing we will notice if they have any infections and all, they refuse feeds and they don't feel hungry. So anorexia, fever, pain, and discharge will be the important features, and they will be pulling their hair or ear and all, and they'll be frequently touching their ear or over the mastoid bone and all. That's again another signal that they're having some problem with the ear. So regarding the management, oral toilet, it means you can clean that canal, and antibiotics based on the culture and sensitivity can be started with steroid drops like for inflammation relief and surgical management. Meningotomy or tympanoplasty will be done. Meningotomy will be performed by inserting a tube and through the tympanic membrane, so that it equalizes the pressure inside. So that's a meningotomy. Then what kind of food can be given? It should be liquid or soft. Because of ear pain, they cannot chew properly. So liquid or soft food is ideal. Then analgesics, very important. Acetaminophen or ibuprofen kind of simple analgesics can be given. What position can be given? They can sit up and lie on the unaffected side. So that helps for the promotion of drainage. And use warm compress or cold compress to relieve the pain and to improve circulation. So that's all about CSOM, and remember about the criteria for CSOM, and also remember the organism causing this, risk factors, and what kind of diet to be given. Heard about this? Dix Hallpike maneuver or Epley maneuver. It's usually doing in which condition? BPPV. Benign paroxysmal positional vertigo. is one of the most common cause of vertigo, and sudden sensation that we feel like head is spinning inside, or we are completely spinning and all. It's a most like not very dangerous. The danger is like if they fall and all, that safety issues can come. Otherwise, ENT point of view, it's not very dangerous. So that's all for today, and we'll be continuing tomorrow again with another topic. Till then, keep learning. Stay tuned. Bye.